We're now going on to air pollution and respiratory health in the UK, and I think that's going to be presented by Tim Dexter from... No, Sarah, excellent. Sarah, thank you. So Sarah's the CEO of Asthma and Lung UK. Welcome, and you're going to be talking about air pollution and respiratory health in the UK.
There we go. So I'm Sarah Woolnough from Asthma and Lung UK. Really delighted to be here with you today. My task is to give you a sense of what we hear from people living with lung conditions and people interested in lung health. And I think it follows on very nicely from what we've heard, because what I will endeavour to do is give you a sense of what we hear from people day in, day out. And if there's nothing else you take away from the next few minutes, it's that millions of people living with lung conditions tell us all the time that air pollution is a problem. It impacts the way they can live their life, it exacerbates their lung condition, and they want bolder action to tackle the problem. A word about Asthma and Lung UK. We are the product of a merger, the coming together of Asthma UK and the British Lung Foundation. And so we now cover all lung conditions, which is really helpful and interesting in lots of ways, but it does give us a perspective across different population groups living with different lung conditions. And actually, air pollution is pretty common as an issue of concern amongst young and old, those living with asthma, COPD, bronchiectasis, as you will hear. But we had published a new strategy last year, really focused on transforming lung health. And it's because we are very dissatisfied with the status quo. It's an interesting point, and we were talking about it just yesterday. We don't have as good data as we would like on respiratory conditions across the UK. So there's a bit of a conversation about, well, just how many people are living with a lung condition, how does that break down? There is also absolutely a case of lots of people living with undiagnosed asthma, COPD and other lung conditions, exacerbated by the pandemic, because we haven't been testing people in the way that we would like. So there's a lot of people without a formal diagnosis. But what we know is that respiratory health it creates a big burden of poor health in the UK. 1 in 5 people will experience a lung condition, either a chronic condition or a more acute condition like pneumonia. It's the 3rd biggest killer in the UK, and if you think about the attention, the resource that some other healthcare conditions get versus respiratory, we think there's a disparity there that we need to be bold and be urgent about to advocate for more action. Every 10 seconds someone has an asthma attack, every 5 minutes someone dies from a lung condition. So this is not something that we should underplay. Lung health is hugely important, and we are not doing terribly well in terms of our lung outcomes. So why have we had a focus on clean air? Why do we have a focus on clean air? I should say we do 3 things as a charity. We fund medical research to better understand lung disease, develop new treatments and so on. We provide advice, support, services. We have a website that millions of people come to. We have a helpline that takes about 30,000 calls a year. We run support groups, so we provide advice and support, and then we advocate. And the reason that clean air is one of our 3 priorities in our current strategy is because we know it's having a huge impact on people living with lung conditions. They have told us that in their many thousands, and we are responding to that. One of the other speakers referenced looking outside and not being able to see air pollution, and that's something we come up against all the time when talking to beneficiaries, when talking to policymakers and others. And actually we published a report a couple of years ago called The Invisible Threat, which did an analysis of schools, care homes, GP surgeries mapped against levels of PM 2.5. In order to make the point really that we can't see this, but we know it's damaging our health, and we know that we are exposed, many millions of us are exposed to air pollution levels higher than we would like, recognising there's no safe level of exposure to air pollution. this is the sort of audience and the sort of room for which most of this will be very familiar, so I won't labour on it. But as we've heard from Paul, there's a very strong evidence base which is linking air pollution to premature mortality. We know, and this is the charity that's beneficiary facing and there to support people living with asthma and other lung conditions, that some people are more vulnerable than others. That air pollution has a greater impact on people from deprived areas, and that's borne out in the contacts we get from people, the communities often who are most worried about air pollution. Now, there is a typo on this slide, which I must point out to you, but we have just published a new report where we looked at the activity that is being driven forward at a local and regional level. So really trying to bridge the gap or understand, do some sort of analysis of what government says should happen, what local authorities and others at regional level have been charged with doing, and what has actually come to pass. And unsurprisingly, for many of us who are sort of closely watching this, we are not seeing the sort of policy measures and advocacy and action and clean air zones and so on that we would like across the UK. But out of the 24 million people estimated to be living in areas that are illegally polluting, at least 1.4 million have asthma or another chronic disease. So this, I suppose, builds the picture that air pollution is a health emergency, and as the National Lung Charity, we are keen to be very active in both raising awareness but also then advocating for change. This references the analysis we did looking at PM 2.5 levels across different public buildings, schools, hospitals and so on. And actually this was very helpful to go out and talk to policymakers about, because the key message was, look, people have no choice about where they go and visit a GP or the care home they may end up in, or if you're in school, the air that you're breathing. And so there's an even more urgent case to take bold measures. This has been alluded to already as well. You are 7 times more likely to die from a respiratory condition if you live in one of the most deprived communities versus the most affluent. So this is an issue around social justice, and I think we have to be clear about that, and health inequalities. 54% of those with uncontrolled asthma in more deprived communities. I think really what I want to show you today is not what we say, but what we hear from people, what they tell us, putting beneficiary insight at the heart of everything we do. And I think this has taken some of us at the charity by surprise, just how many people living with a lung condition report to us in loads of different ways every day how air pollution is affecting their lives. I'll leave you to read a couple of these quotes and then hopefully a short film will play. And this really illustrates, some of this is the tip of the iceberg. As I say, we are hearing all the time from people who are worried, who do read scary headlines and are frightened and scared and don't know what to do for the best, for their families, for their children, for their elderly relatives, particularly if living with an existing lung condition. But I think the other point really is just how much people are having to change the way they live. So not exercising, not going outside on high air pollution days, really talking about moving city, moving out to the country, things that we shouldn't be having to ask people to do. So it's an urgent problem. Now, I hope this will play.
Enters into the human body, affects every organ in the human body.
Emissions fell between March and May by 36% during lockdown.
This is a public health emergency.
I think there's an issue of social justice.
There's been talk and consideration of measures. Now we need action.
Well, let's talk now to Ella's mother, Rosamond Kissy Deborah.
If there might be a link between Ella's asthma and air pollution.
Ella's death was caused by the poor quality air.
Death and disease that otherwise would not have occurred.
Busy roads are South Circular here, not far from where Ella lived.
Air pollution is then listed as one of the causes of her death.
The air she was breathing really did kill her. My message for COP is, unless the air is clean, you are never going to solve climate change. And all governments everywhere, they have a responsibility to their citizens, making clean air an actual human right.
Air pollution affects my asthma. I was playing some football and then after my lungs just stopped. I couldn't breathe at all. I fell down and coincidentally, Great Ancoats has a very high air pollution density. It's very probable that I have asthma because of that air pollution.
I'm sharing my air pollution story. I'm co-organizer of a campaign group called Trees Not Cars. A very controversial planning application was put through by City Council. It was for a 440 spaces car park next to a primary school where Maxim went. We have successfully appealed this application in court and a decision was granted to stop the car parking built on 8th January this year. I think governments should take action now, and it affects our health, it affects our children's health.
People who live near main roads, they are suffering and they're breathing this filthy air. So we have an inequality in health.
We just want some clean air for ourselves and our children and our next generation.
It damages our lungs. Save the environment, plant more trees. Stop idling and turn your engine off.
We are sharing our story because we want other people to be safe. And my friend Lily has asthma and it's really hard to breathe for her, and she had to move houses and it was really difficult for her.
Children are ending up in the hospital and we want to stop that.
We're sharing our air pollution story because we want to tell people who have cars to stop going in their car everywhere so they can walk more.
I'm sharing my story because I don't think people realise, and because I'm a grandfather, I'm aware that when they take the kids out, they're going to be exposed to heavy air pollution. Anybody at any time can end up like me, and I didn't think I would end up with asthma, especially being a non-smoker all my life. We need to see stronger clean air laws. If you live in a more affluent area where you're away from the industry, it's going to be better, but any city dwellings, it's just unavoidable.
We live in a very polluted area in Liverpool. We are concerned about our health and our futures. We have started an air pollution project. We are mapping out where we spend most of our time so we can measure the air pollution. That includes our school, homes, youth club and even football. Our next steps are sharing our findings and making recommendations to local leaders. COP26 is an opportunity to clean our air.
And it's quite a historic video because we filmed it just ahead of COP26, but I hope it gives you a sense of what we are hearing from people and how they are motivated in communities to make changes. We have carried out a lot of surveys, so I mean to the point about how do we persuade policymakers and decision makers to take this seriously. Well, one of the ways we do that is to highlight the scale of the problem and then highlight how supportive or otherwise people are about various different interventions. I mean, I don't want to labour the point too much, but if we drill down into what is going on, people feel wheezy, their symptoms flare up. So many people who we are surveying, who we are going out and speaking to, talk to us about the direct impact of air pollution on their health. So, what are we trying to do about it? Well, we are trying to take quite a holistic approach and say, ultimately, we do need bolder clean air laws. We can't get away from that, and that's going to make the step change we need. So we have been, with many other people in this room, trying to influence national policy, calling for bolder air policies and calling for a health-first approach. I mean, we often refer, and Rosamond will probably talk about it, but the coroner's report in Ella's case, and that talked about the need to tackle the problem at national level, but also then tackle the problem for the public and for health professionals. So we are trying to do quite a lot to raise awareness and to call for better education for healthcare professionals. So improving our health advice, and encouraging and supporting and empowering people to campaign, because as you see, lots of people in local communities at regional level feel very passionately about what they see sort of on their front door, and want to, particularly often with the use of data, get a better sense of what air pollution levels are like, and lobby the local authority, the council, local decision makers to make small changes. We publish lots of reports to try to bring some of this insight to light in different ways, and we are working with lots of different partners. I mean, those of us who've worked on other campaigns and in policy know that strength comes in partnership and collaboration. So through the Healthy Air Coalition, we're trying to bring together like-minded organisations, often coming from slightly different perspectives, to build this strong partnership to say, we need change, we need it now. This refers back to one of our most recent analyses, which is showing that we are falling short. We are not delivering what we've said we will and what we need as a country. We have new national targets. They're not as ambitious as we'd like them to be. Local authorities' clean air plans are slow to be enforced, they're poorly resourced, and not enough is being done to educate the public and those most at risk. And we see pollution levels bouncing back. So many people through the lockdowns told us they felt their health had got better, they could do things living with lung conditions that perhaps they hadn't previously been able to. I mean, you heard the little girl whose asthma went away. Well, these things are coming back, and we're particularly worried about some of the cities that we work in. We do operate across the UK, so putting this in front of local politicians, regional politicians, for example, Andy Burnham, to say, come on, your approach is not what it should be in Manchester, we hope will help drive change. And this gives you a summary of, I think, what we'd all like to see. But I think the point is we need to tackle this problem, and what our beneficiaries, what people that support Asthma and Lung UK tell us is, we want to see action on loads of fronts. You've got to tell us more about air pollution, you've got to tell us what we can do in our daily lives, you've got to give us the information, the data that tells us what air pollution is like where we live, but please also advocate for change, central government, local government. That's all I really wanted to say. Thank you for the invite to speak. It's lovely to be here, and you know, I think what's so wonderful to see is the different parts of the community coming together to advocate for change.